Alright, so here with Erin, and this video is about how long does it take for your swelling to go away after a rhinoplasty. And as you read online, you'll see anything from several months to a year to 2 years to 5 years, and in reality, about a year. It takes about a year to enjoy the full results of a rhinoplasty, except if you have a little thicker skin or if it's a revision rhinoplasty. Those cases sometimes take a little bit longer. Sometimes people with really thin skin will see most of their final results even earlier on, 6+ months, something like that. So with that, Erin, how long ago did I work on your nose?
About 7 months at this point.
About 7 months ago. So Erin was just a civilian when she came in here, and she chose us like anybody else would. And how long after I did your nose did you join up working for us?
Only about a month or two afterwards. It was
so as she was drifting off to sleep, she says, "I would love to work here." And then 2 months later, here she is. So she has a unique perspective of both the inside and outside of the practice, what it's like to have your nose done here. So Erin, why don't you tell them what you felt like at a week and at a month, let's say.
Okay, so right afterwards was actually, even just right after the procedure, was probably one of the most significant times, just because it's not painful by any means. More than anything, it's just a little bit of discomfort. At about 1 week, I was very ready to get my splint off and see my nose. And we're always told up front, we always tell all of our patients up front, at 1 week it's going to be a little bit too fat and a little bit too up. And so I was able to capture
too
pictures.
Too fat means it looks this way, and then too up means it looks a little piggy at a week. And did you feel like we're looking a little piggy at a week?
A little bit, but now that I look back at that time, I tell a lot more than I could at that point. Like, when I was living it, I was like, I could tell a difference right when I took the splint off. But I noticed it a lot more looking back at pictures of myself at that point. I felt like it, but, and my dad even mentioned, her nose is a little bit too up, and I had to be like, Dad, that's gonna go away.
Yeah.
Like, it's all temporary, it's all the swelling, so.
And at a week, usually we can see improvements in the bridge already, especially if we made a big change in the bridge, you can usually see that at a week. Did you feel like your bump was better at a week?
Well, I wear glasses too, so I always had to wear my glasses either underneath my bump or over my bump when I had the more of a bump on my bridge. And I noticed right away when I put my glasses on that they just slid right over. And I even felt, because I had pressure at one point, and I felt, and I was like, whoa, where did my bridge go? It was so much narrower, and it was really cool.
So usually at a week, bridge, you can see that pretty well. You can get a good sense of profile, although on many people it looks a little bit too up. A lot of people tell me their smile doesn't look right at a week. What did you think about your smile at a week?
It was funny. I remember thinking that I hoped it would get back to normal a little bit more, and I think a lot of it has to do with the fact that, you know, you cut so many nerves in this area. I was numb in this point for a little while, and I kind of felt like my upper lip wouldn't pull up completely.
Yeah.
That's totally gone away though. I mean, very quickly I felt like it went back to normal.
And both of those are swelling. The numbness and the people say their smile, they don't see enough of their top teeth the first few weeks after rhinoplasty. Because the swelling in this area does feel numb, and it also, the lip doesn't rise as naturally and passively when you smile, so it kind of sits down and you smile, and people think it looks a little goofy sometimes when they first smile. Usually the next time we see people back is at about a month, and most of my patients at about a month, they're really starting to feel it and feel like they look better. What do you think changed the most between 1 week and 1 month?
1 week and 1 month, a lot of the swelling went down.
And where in particular do you feel like?
I feel like mostly right in this area is where a lot of the swelling goes down. This area I refined quite a bit for me. And the tip really got very straight by 1 month. That's pretty consistent.
That's a good point. So a lot of times we have irregular swelling, and you can have uneven swelling to one side is more swollen than the other, or one nostril is more swollen than the other. And all it does to really try to make a lot of comparison side to side in the first few months is just make you nervous. So there is such a thing as uneven swelling. It happens. It fades away unevenly. And so just like you said, looked a lot better at a month than it did at a week, and that's because things are starting to settle into place. Most people say their tip, as you did, this section starts to look more normal, less piggy, and it never looks terrible. We'll have Erin was good enough to take a bunch of selfies as she healed, so you can see all these examples. So it never looks terrible. You can start to see some elegance showing in the tip at a month. The front view doesn't look as full at a month. And do you feel like it's swelling in your cheeks at the 1 week visit?
Yeah, definitely.
Cheeks,
absolutely.
and that's starting to fade at a month. By 3, 4, 5, 6 months, turn this way a little bit. You're starting to see, so this is 7 months in. Now we're starting to see what really sets a tip apart, or sets a rhinoplasty apart. Can you get in a little closer on your nose for me? Kind of a nice job from a really nice job. And things like little bits of definition where she has a straight bridge, but she still has definition where the bridge is offset from the tip. So there's, we call it super tip break, but it's not because she has a scoop on her bridge at all, but the tip has just a little bit of elegance. It sits a little bit in front of the bridge. You can't see that, certainly not at a week, probably not at a month. When do you feel like you started to see kind of secondary shapes, like the little things just like this?
Yeah, honestly, closer to 2 or 3 months. Really closer to 3 months, I would say, because I see little like curvatures, kind of angles that are becoming apparent as the swelling continues to go down, and things like that become way more apparent. And it was probably about 3 months, because all my coworkers here even said, I can tell your swelling has gone down since you started, and that was around 3 months.
So what's really interesting about this is we just kind of casually say swelling going down, swelling going down. And it really is, it's swelling going down. But it's not swelling for the full year. The first few months it really is swelling decreasing. But the soft tissue actually contracts. It changes shape and it shrink wraps onto the new framework that we made with the rhinoplasty. And that's actually, believe it or not, very similar to wound healing, or very similar to, embryos developing into fetuses, into babies. Their tissues remodeling, and that takes time. And so what's happening over these next several months is actually the tissues are truly remodeling. Their collagen being formed, it's contracting. And the tissues are actually not just not swollen anymore, but they're different, they fit differently. And that's that last several months. And it really does. On the thin skin, Erin's got thinner nasal skin, 9 months, it's mostly done. Average skin, more like a year. And on someone with revision rhinoplasty or real heavy, oily, thick, porous skin, it really can be 2 years by the time that whole shrink wrapping modeling process takes place. On average though, most people, they look okay to go back to work with a little bit of residual bruising and swelling at a week or so. By a month, they feel pretty comfortable in pretty much any situation. And when would we say wedding pictures or senior pictures, or when would you say that would be a good idea?
About 3 months after. And even just because we say there are little residual things that can, happen that take a little while to clear up. Like I had that one stitch in the corner of my nose that took a little bit of a time to clear up. Nobody would have noticed it, but we just wanted to get it gone, and we wanted to make sure that would be, gone and taken care of before any big things, and that's why we tell patients the same thing.
That's a good. So, in general, return to work or school a week, little bit of residual bruising and swelling. If you really, really, really want no one to know anything, it could be as much as 2 weeks or 3 weeks if you're a terribly easy bruiser. By 3 months, that's usually, again, senior pictures, wedding pictures. Most people wouldn't have an issue with any of those things at that point. And the last thing I'll say, and we tell this to a lot of our patients, if you really want to try to get away with nobody knowing anything, you can make a big change to the nose as long as the final product is natural looking. If the final product is natural looking, it really doesn't attract attention. People might notice you look different, in which case we say distract them, cut off half your hair, get highlights, or get a big pink mohawk or something.
Yeah.
That kind of thing, and they say, oh, you look different. And you can say, oh, well, I 6 inches off my hair and got it highlighted, and it really distracts people really well. Mm-hmm. So, anything else you want to add as far as what your so far healing process has been like?
Not really. I would like to say that it was really, really helpful when I came back in and I had the bruising, since I was such a easy bruiser. It was really helpful to meet with Chris right afterwards, and she showed me how to cover everything up with the Jane Iredale makeup. It was amazing. I got the concealer little package, that's the color correcting concealer, and it was awesome. It was really, really helpful in covering up my bruises, and I still use it today. So it was really cool.
So yeah, I think that's good to know. We have some great estheticians. And then the last thing is this sheet that Erin helped put us together here. I think it'll be helpful for anyone, whether they're here or somewhere else that's had a rhinoplasty, watching their nose evolve, because it's nice to know that that's a real thing. When we say it looks this way at 1 week and this way at 1 month and 3 months, to see those on timelines and pictures next to each other. I hope that helps you guys out. And I think we have that overlaid on the video here and there, and it's also downloadable on our website. Thanks a lot.
Thanks, Erin. Thank you.